Hi, everybody. It's Jen Kovich-Bordnick with Executives for Health Innovation. Welcome. We've got a really exciting day, and this is just in the nick of time. So I'm really delighted that we've got David Pugash with us here today, who's the VP of Government Affairs and Public Policy from the American College of Physicians. You know what? Let's just pull the, there we go. We're talking today about what do the November 8th election results mean for the future of healthcare policy. And we've had to reschedule this because I think, as everybody on this call knows, we've been waiting anxiously for the results to find out what's going to actually happen with the election and the House and the Senate. And it looks like we finally have some answers today. So that is great news. So we're going to be able to jump into this discussion a little bit more meaningfully than we would have been able to, say, a week ago. So thank you for being patient with us and hanging on with us while we have the discussion. We are waiting for Julie to join us. We're having a little bit of a technical issue, but she will be on with us momentarily. We can go to the next slide. For those of you who don't know us, eHealth Initiative has turned into Executives for Health Innovation. We are still EHI or EHI, a catalyst for healthcare transformation, but we've got our new name now. And with that, we've got a whole slew of new activities that we're focusing on this year and going into the new year. Again, focused on collaborative learning, shaping policy and thought leadership. Go to the next slide. And our four core focus areas that we're looking at: patient experience, health equity and access, digital care, and privacy and cybersecurity. And let's go ahead and just pull those down, Emma, and let's just jump into the conversation because I know we've got real limited time today. I've got online with me here today, Emma Valinsky Lloyd, who is my partner in crime here. Emma, thank you so much. She's going to be in the chat room with everybody. We welcome your questions and comments as David and I are here, and we will take them and refer to them. So feel free to jump in the chat box right now. If you've got questions or thoughts about what we're talking about, please, we are anxious to hear them. And here's Julie, yay. Julie, you're on mute, so you've got to unmute for a second. There we go.
Here we go. Yes.
Oh, excellent. Thank you. So glad that you made it, Julie. Okay, so we've got Julie and David with us here. So we've all been on the edge of our seats for the last week and a half post-election. Although all the election results aren't in, we finally have some answers today and just in the last hour with Nancy Pelosi effectively stepping down from her leadership. So for those of you who have not been reading those notifications on your phone, Nancy Pelosi has stepped down. So we do know two things. We know that the Senate will be led by the Democrats and Chuck Schumer, and we know that the House is going to be led by a Republican, although we are not sure yet who that might be. But this is going to be really different. So a lot of changes for Congress coming up. So let's just jump into this. And with the big news in the last hour, I'd be remiss if I did not just kick off with that. So David, how do you think that's going to impact the ability to do healthcare policy?
So no, Jen, it's a great question. And that obviously is, something that, really will be hard to predict, I'll say, for at least a couple of reasons. And the first is, I think, as everybody knows, one thing that Nancy Pelosi is well known for is, her leadership with the Democratic caucus and the way she has managed to keep, Democrats in the House united to pass, signature healthcare bills. And when in the minority, to hold the line, to bring about changes that either a Republican administration or a Republican majority on policies that they weren't in control of. And the question is, how will new leadership be able to manage the various factions and priorities within the Democratic caucus? We just don't know that. And you know, only time will tell. The other you know, big wild card, of course, stating the obvious, is that this is such an evenly divided House, you know, with a Republican majority, and there are going to be similar challenges with the Republican conference. And so the fact is that you may see partisan legislation, not you may, we will see partisan legislation, you know, make its way through the House, but for anything to really, you know, be accomplished, you know, it's going to be probably a narrow list of bipartisan priorities. And I think there are, you know, things in healthcare that do enjoy bipartisan support. So there are opportunities both in the lame duck and next year for progress on health policy.
So let's just, I mean, I already see Amanda Green's comments here in the chat, so nothing's going to get done in the next couple of years, but let's give it some hope. So Julie, I mean, what can actually get done in a bipartisan Congress in terms of health?
I think there are a few issue areas where there is support, especially I look at things on the Energy and Commerce Committee around workforce, the healthcare workforce needing to be grown, and telehealth strike me as two areas. Also behavioral health. There's been, with the opioids crisis, there has been a great recognition in recent years that there needs to be more support for that. So those would kind of be the three issue areas that I think there may be some bipartisan interest. It would be narrow. It's not going to be some big, huge package, but I do think there are areas of opportunity. Congressman Burgess of Texas, who has a leading role on ENC, and one would expect him to, with them having the Republicans having the majority, I think will push on the workforce issues. And I think telehealth has been immensely popular, and both in cities and in rural areas. And I could see more work to increase what can be paid for, you know, with telehealth delivery.
Okay. David, anything you want to add to that list?
No, I'm in agreement with Julie. Telehealth is definitely the top of my list of issues that enjoy strong bipartisan support. You know, that's an area we're going to see. I think, you know, as Julie noted, behavioral and mental health, and, you know, expanded coverage for those services is another, you know, area of support where, you know, there's going to be both bipartisan support and I would say, you know, a lack of consensus that you know, sort of transcends party lines is going to be on some of the workforce policies, especially as it relates to, you know, utilization, you know, to expanding access to healthcare services, you know, with, you know, utilizing, you know, healthcare professions beyond, you know, the physician workforce, you know, graduate medical education, there's, you know, support for, but of course, you know, paying for it is always the challenge. But I think that's, you know, those are the you know, areas, you know, one item that's on our wish list, which I think there's potential, but paying for it is a challenge, is macro reform, prior authorization reform. You know, there's legislation, you know, that cost is a concern, but has very strong bipartisan support, but that's probably the extent of what's on our list right now.
Well, you know, Julie referred to the telehealth, and I know that the public health emergency keeps getting extended 90 days, right? And nobody's anxious to see these waivers go away. That, you know, for our constituency, there's so much interest in being able to extend these telehealth waivers. Do you think with a bipartisan Congress, there's any chance of, you know, policy and legislation being able to extend those indefinitely or beyond the 90-day public health emergency?
So since Julie's on mute, I'll go first quickly, Julie, and then defer to you. But one, we are fortunately, and it's a double-edged sword that there's right now no urgency to get anything through this Congress, although it's possible. And I think that's for two reasons. One, through the I guess it was the FY22 Omnibus Appropriations Act, we have the 151-day extension following the end of the public health emergency. The other piece of it, of course, is that we did not see an announcement from HHS. So in the absence of any news, there is the, you know, assumption that the public health emergency gets extended for an additional 90 days come mid-January. That said, you know, we do have telehealth legislation that, did clear the House over the summer. So it's possible, that the Senate, could, do it as part of, a list of bills that, potentially get through, on UC in the lame duck. But, and certainly we all would like to see that. But the good news is at least there is going to be, stability for probably, taking us into the summertime, based on another 90-day extension, and then, at least 151 days after that.
Yeah, Julie, what do you think?
Yeah, I would agree. I think we're probably going to have this go for a period of time more, especially too, as we're getting into the winter months where there could be, it is actually kind of a little bit in Biden's interest to try to keep the public health emergency going, as far as when he was caught, I guess, saying, oh, we're out of the pandemic. It really didn't play well to some of the arguments he was making about needing to generate more funding. And now we're looking at, I just saw today, the pediatric groups are asking for an emergency request, basically around RSV and the flu. And so I think as the temperatures get colder, there's going to be more reoccurrence, resurgence of probably a kind of a mix of the COVID, the flu, and RSV. So this may be an area where you can have extensions for a while on the public health emergency, or at least when you look at the 151 days after it, expanding upon that through Medicare rulemaking.
Okay. And David brought up a great point about the lame duck session, which I just, dying to hear both of your perspectives. What do you hope will get accomplished? What do you think will actually get done?
I think physician pay is going to be addressed. There are some pretty significant physician pay cuts that were set to go into effect. And there's just not going to be any tolerance for that. And there shouldn't be. And so I think that is an area where there will probably be bipartisan consensus to not have those cuts go into effect.
Yeah.
Yeah. So on physician payment, and Julie, I certainly hope you're right about that. There's basically two big, cuts. One is the 4% PAYGO cut. There's I think a optimistic assumption that PAYGO gets resolved and wiped clean, as is all, nearly always the case. But then you have the 4.42% budget neutrality cut on top of that. And that's where I think there's much more of an open question, because there is clearly a strong recognition, members of both party leadership in both parties, that, patient access really is at risk if, Medicare payments rates aren't sustainable, especially for, vulnerable, populations, physicians practicing in underserved communities. And so, but the real question is, does Congress put in enough money to basically keep, I don't even want to say keep physicians whole, since of course there's, they're falling further behind because of, a lack of an inflationary update, but to at least, prevent the entire 4.42% cut, or do they only offset a portion of it? Obviously, we're pushing hard for Congress to take care of the entire 4.42% cut, but that to me is the big question: is Congress able to prevent the entirety of it, or just a portion?
Yeah. What else in the lame duck session? Do you see anything happening while we've still got the Democrats in control in terms of women's health or reproductive rights, or anything with women's access before they lose control?
I think that Jen is likely going to be dealt with more in rulemaking. Okay. And where we're already seeing this is around HIPAA and data privacy. And I think Biden had kind of laid the groundwork a few weeks ago. At HHS, there was kind of this framework around AI and artificial intelligence. And I think what is sparking a lot of his interest around doing more in AI related to healthcare has to do with the Dobbs decision. And so what I could foresee happening is we kind of have two tracks here on privacy. We've got this effort that's been ongoing in the House and potentially has kind of just been languishing in the Senate around the American Data Privacy and Protection Act. There is bipartisan support in the House coming from both Kathy McMorris Rogers and Jerry and Pallone. And so, it really all kind of the main holdup in the Senate was Maria Cantwell, because she kind of wanted more of a private right of action, a blanket private right of action, more enforcement opportunities. Given that the Senate remains in the Democrats' control, I don't necessarily see her budging on that. But I do think that on the other end of it, there's going to be need for protections that you can't get passed in Congress. And so there may be some kind of trying to stiffen up some aspects of enforcement around data privacy through HIPAA or through other things. And that's where I could see the Biden administration having.
David, what are your thoughts on both privacy and women's health?
So I think what Julie said is spot on. I think the Federal Trade Commission is likely to be, active in this space as well, since, a lot of the concerns you're hearing about the need for additional protections, fall outside, the scope of HIPAA. I know there's concerns with the House legislation around preemption as well, which complicates it, but ultimately, leadership's going to have to, make a calculated decision about, whether, the current version of the bill is, the best deal possible, compared to, what might come out of a Republican House next year. So, I think, the way Julie framed it makes complete sense. And I think that's what we're likely to see. And then it really will be, looking to the administration and what they're able to effectuate through, rulemaking or sub-regulatory guidance next year, similar to what we saw, this summer, around, sort of the role of EMTALA, for example, which is obviously being challenged right now as well.
Yeah. Any other thoughts on the lame duck session?
So appropriations is really the one other area where I think, there's a good chance Congress will get something done. There's, every incentive to, get an omnibus through. You have the, member directed projects back in, which is one more reason. And you have, a retiring, ranking member in the Senate and Senator Shelby, as well as, in the Labor HHS subcommittee and Senator Blunt, who I'm sure are really interested in seeing their priorities included. So I would say there's, a pretty good chance we'll see an omnibus get done, whether, there's a short-term extension of the CR, to buy a little more time or not, sure, probably, but I think appropriations gets done. Now, whether there's supplemental funding included, relating to COVID-19 and monkeypox, that's obviously a whole other issue. And I'd say that seems, not particularly likely, but I think an omnibus probably.
Okay. I mean, one thing that we should probably mention is, there was a big turnover in terms of governor's races. So we've got, Michigan, really flipped houses and also governor's races. So, and somebody mentioned something in the chat here as well. I mean, what impact do you think those state races could have in terms of state legislation related to health?
Well, I think around states, I would imagine, and we've definitely seen it at United Health Group, I would imagine there are going to be more bills in some of the Democratic-led legislatures that take on healthcare entity-led merger and acquisition activity. Mm-hmm. I could see also bills around, there's a movement afoot with the American Medical Association kind of addressing things like prior authorization. I think we're probably going to see more about clinicians other than physicians, for example, scope of practice, given there's been kind of a recognition with virtual care delivery about the role of nurse practitioners and some other kind of master's level providers. I would imagine there may be more effort afoot in some states to give them more rights, or at least make it easier for them to get virtual care delivery and stuff without supervision, things like that. That'd be my guess.
Does that look like a bipartisan issue to you, Julie, at the state level or in terms of the nurse practitioner and clinician piece?
I think possibly, yeah, I think possibly. It just depends on the state, but I do think that is increasingly becoming more of a bipartisan issue.
Okay, great. David?
No, I agree with Julie. I think, the, issue of like health system mergers and overall consolidation in in healthcare delivery, has been a growing concern across the country. And I think there may be, as Julie suggested, a greater appetite, and it just becomes a higher priority, based on, the landscape in different states now, and scope of practice. Absolutely. I mean, it's been a big, in states that haven't already provided expanded or independent practice rights for advanced practice nurses. It's an issue, and as Julie noted, between the advent of telehealth, what the expanded role for range of healthcare professions through the pandemic, and just the recognition that, I'll say, that there is a need to strengthen health equity and expand access in underserved areas. There's a view that utilizing nurse practitioners, and advanced practice nurses can do that. Not to, get into a debate over the merits of it. The data suggests otherwise, but I think you've seen bipartisan support in a number of states for utilizing scope expansion to try to improve access.
That's great.
And that's going to continue.
So one more question on that, David, is, Medicaid expansion. So with some of these states turning over, do you see Medicaid expansion going to those, I think it's 11 states now that don't have it?
So, off the top of my head, I wouldn't be able to name all 11 states. The ones, that are sort of top of mind. The short answer is no, unfortunately. But, South Dakota did pass a ballot initiative, to support Medicaid expansion. How the governor moves forward with that, obviously, though, is the big question at this point. So, clearly South Dakota, one of those remaining states, presumably will move forward in some fashion. But I think it's, we could assume there'll be some sort of, waiver that they would apply for. It'll be a protracted process. But as far as, the other 10 states, at least the ones that are top of mind, it seems unlikely.
Julie, you agree?
Yeah, I agree. I think it's unlikely. You look at most of the states where it still has not been enacted until the expanded. They're large states. They've got Republican majorities, and there's not an interest in doing it. Will to do it, I guess.
But Jen, real quickly, one aspect of Medicaid, though, that maybe that really is a big unknown, is the impact of the end of the public health emergency on Medicaid eligibility, and ultimately, health insurance coverage for millions of people, because I'm trying to remember which of the original early bills allowed for it, but then under the public health emergency, you've had this massive expansion of Medicaid enrollment. States have been left sort of,
I think it's like 9 million additional people.
It's this massive number, and again, whether ranging between like 5 and 15 million people.
Yeah.
And obviously, many of those people presumably lost their jobs. Medicaid provided a safety net for them. Unemployment's obviously back down to record low rates, so no longer necessarily need it, but they're still, sort of at least considered eligible. So we don't know how many people will lose that safety net coverage who still need it, but there's going to be millions of people who will fall off their state's Medicaid enrollment at the end of the public health emergency. And what impact it has on access and coverage for those folks is right now very unclear.
I think this public health emergency and the extension of it is just going to be a huge issue. I mean, I don't think people recognize the number of the access that's increased through the telehealth,
Yes.
the Medicaid.
It's going to be a huge clip. I mean, and I don't think
Yeah.
people are seeing it. I know in our businesses, our lines of business, we're really foreseeing it. And we've been talking a lot about how do we keep the Medicaid up there, keep people insured. It's really, I think Biden and, Becerra, and I know that there was a meeting recently, CMS administrators really thinking about it, but I do think outside of that group, a lot of members of Congress are not yet thinking about it. And it's going to be a real problem. Yeah.
Yeah. That's good. We should have a whole discussion just on that. Let me ask you about, the leadership. Let's just play kind of a guessing game in terms of the House and also the committee structure. I mean, we're, thinking we're going to see a real turnover, but the committees that impact health policy, who do you think is going to be at the head of those in terms of the Republican Party?
Well, I still think Burgess for ENC.
Okay.
Energy and Commerce, is a physician, member of the Doc Caucus. He's done a lot on a lot of workforce issues and things. I tend to think it will be him.
Okay.
I don't know. Who do you think, David?
I agree. And, one of the things that, he's worked very hard over the last couple of years and beyond, both on, key policy issues, but then also to, help, support, their political efforts as well. So I think he's, done himself, and, in the committee, I think, a great service to, and so he's, I think positioned well for the health subcommittee. And, I trying to think back, I think he even still has like time left, sort of from the last time he chaired the subcommittee, to the extent that that's taken into consideration. Where I think there's much more of an open question is on the Senate side and what happens with the health committee. That's going to be really interesting for a number of reasons, but one, significant factor is, that the Appropriations Committee, both the chair and the ranking member, are retiring. And so that means you're going to have, senators who are going to be elevated into those roles, on both sides of the aisle. And, the people who are next in line, so to speak, on appropriations are also next in line, essentially, or currently, in place potentially for the health committee. So that's, I don't have any, insight, but I think that's just something that's, going to be worth watching out, because, you have, Rand Paul, who is, next in line, but then after him, it's, Susan Collins, but Susan Collins, could very well be ranking member on appropriations. And then, after her, it's, Senator Cassidy. So, health will be really interesting to see. But then on the Democratic side, Patty Murray is, both obviously, chairing health, but then she's now in line to chair appropriations. And so presumably that'll be her choice to make. And then, after her, it's Senator Durbin. If he wants to give up judiciary, then he moves up, on appropes, and, and so there's a lot there to just pay attention to, I'll say.
A lot of musical chairs. So any kind of rising healthcare stars we should be on the lookout for, other
I
than
heard that
the usual
Shelley,
suspects?
I guess the reading this morning, Shelley Moore Capito may be wanting to make a run for more senior position.
Oh, great. Interesting.
Oh.
Interesting. So we're almost out of time, but I hate to start talking about 24, but what do you see as the primary healthcare policy issues for the upcoming presidential, I said it, election? What are they going to be talking about in terms of healthcare? Oh, I have a feeling.
Well, it's
abortion will be
interesting.
on there, but
It's
yeah.
interesting because we have had a few states that have tried to do the single payer,
Okay.
where like you think Nevada, Colorado, and California has entertained that legislation. they've been running into all kinds of problems. You did have it passed in Nevada, but the way it kind of is written into the legislation, it's a study period and then, could kick it up. Colorado, there were a lot of concerns about, how to carry it out, because you started hearing from provider groups that you'd have a lot of issues with network adequacy, with having the workforce, not having a brain drain of providers leaving states. So I kind of think that groundswell and the organizing among the health sector that's gone on and kind of trying to showcase how that is not an answer to problems means that you're probably going to have less of that being the main thing that Democrats talk about in 2024. I just don't see as much movement on this kind of concept of Medicare for all, or I think it gets hard to do that, just because you've had some of these state fights and some of the allies that have been involved in these state fights, which span the healthcare sector and often can be people in the healthcare sector who don't typically work with each other very well, decide, this may not be as feasible as you think.
Yep. David, your thoughts?
No, I think Julie's right. It's really going to be, a competition of ideas all around, what can make healthcare more affordable. And I think the debate will largely be oriented around competition, price transparency, things along those lines. I mean, if you look at, what the House Republican, blueprint document, looked like, there's a lot in there, some, language around, price transparency, and there's, letting people buy coverage across state lines, that sort of thing. And so looking ahead to 2024, that's, you'll see, debate around those options. And, I think, in a general election, it probably becomes, public option versus, allowing people to buy insurance across state lines as your kind of competing ideas. That's my quick guess.
And let's just wrap the session with, so thinking about providers, David, what's your top priority with this incoming Congress?
First and foremost, it is whatever can be done to, ease the, administrative and financial burden on physicians, and just, making their practices, more stable, and the time, and giving them more time with their patients. So it's not any one issue. I mean, because in part it's what, gets done this year, but if it is one specific issue, macro reform, which is obviously a pretty big, lift.
Okay. And then Julie, on the payer side, what are you guys hoping to get out of this next Congress?
Yeah, that's a good question. I mean, I think that we have a lot of the same goals around. I mean, we realize the need to grow the healthcare workforce, that there also needs to be more programming to address, areas around health equity, social determinants of health. There is an understanding in our organization too around, some of the efforts to try to make virtual. That's a big one, probably making the continuation of virtual care delivery, making it more seamless. We definitely want to continue to have as many people covered as possible. Our kind of way of doing that has been to have, try to help with some of those Medicaid redeterminations and not have the fear of this cliff where you suddenly have the end of the public health emergency and you have all these people who suddenly are not covered. That's a big concern. So I would say those are the kind of the primary things for the next round. And then we have been doing a lot in the data space around trying to, make sure that there are some guardrails for essentially health data that is being handled by tech companies or people who are, entities that are not HIPAA covered entities. And one thing that is of concern is the FTC just has limited resources, and a recent Supreme Court decision further limited their ability as far as like penalizing companies and things. So it's going to be tricky. They didn't end up getting some of the extra. I think there was $500 million that was going to be in the Build Back Better had it passed as it was, to help them be able to do more enforcement. So we think whenever that's the case, that that if they're not able to kind of enforce, you continue to have consumer data privacy problems running rampant in an area where there's not the guardrails that there is for HIPAA covered entities.
Okay. Okay. All right. Well, we've got plenty more to talk about, so we will have both of you back. Thank you so much for doing this lightning round with us. Thanks everybody for joining us, and stay tuned. We'll be back again in next month. All right.
Thank you.
Thanks, David. Thanks, Julie. Everybody have a great
Thank you.
afternoon.